Hello everyone, welcome to the session on Introduction to Pharmacokinetics. I am Kaushika Patel, Assistant Professor, Department of Pharmaceutical Technology, LG Institute of Pharmacy, Ahmedabad, and in this session I would explain you the basics of pharmacokinetics. The contents that will be covered in the session are definition of pharmacokinetics, plasma concentration time curve after the oral administration of drug. What do we understand by rate constant and order of reaction, and the comparison between zero and first order reactions. So beginning with, what do you understand by the term pharmacokinetics? Pharmacokinetics is defined as the kinetics of absorption, distribution, metabolism, and excretion, and their relationship with the pharmacological, therapeutic, or toxicological response in the man and animals. There are two different aspects of pharmacokinetic studies. First one is the theoretical aspect, which involves the development of pharmacokinetic models to predict drug disposition after administration. Afterwards, statistical methods are used to interpret the data and assess the pharmacokinetic parameters. What do you understand by drug disposition? It is the distribution, metabolism, and excretion of drug. That means what processes occur after the absorption of drug. The second aspect is experimental aspect, which involves development of biological sampling methods and analytical techniques to predict the drug concentration in biological samples and data collection and evaluation. So now let us understand the basic plasma drug concentration time profile. Here you have a plot of plasma drug concentration versus time after single oral drug administration. You will obtain a bell-shaped curve, and the peak of that curve will represent Cmax, that is the peak plasma concentration. The phase on the left side of the Cmax is known as absorption phase, where the rate of absorption is greater than the rate of elimination. So you find increasing curve. On the right hand side of the Cmax, you have a post-absorption phase where the rate of elimination is greater than the rate of absorption. So you can observe decline in the concentration. Hence, Cmax is the maximum concentration which can be achieved in the body, and at Cmax, absorption rate will be exactly equal to the elimination rate. At the end, there will be one fourth phase, that is elimination phase, where only the elimination of drug which has been absorbed is occurring. The plasma drug concentration which is achieved is defined by two important concentrations. First one is the minimum effective concentration, and the second one is the maximum safe concentration. Minimum effective concentration is the minimum concentration which must be achieved in the body to begin the therapeutic action of drug, whereas maximum safe concentration is the concentration above which the toxic or side effects of drug may be precipitated in the body. Hence, it is also known as minimum toxic level of drug in the body. The difference between, or the range between, this minimum effective concentration and maximum safe concentration is known as therapeutic range, during which the therapeutic action of drug is observed in the body. The plasma concentration below MEC will be known as subtherapeutic level, whereas the concentration above MSC will be known as toxic level of drug in the body. Now, when the drug concentration enters in the therapeutic range after crossing the minimum effective concentration, that time is known as onset time, when the pharmacological response of drug in the body begins. And this beginning of pharmacological response of drug in the body is known as onset of action. The maximum pharmacological response will be produced by the maximum plasma drug concentration, that is Cmax, which is known as intensity of action, and it represents the maximum pharmacological response of drug in the body. The total time period during which the plasma concentration remains above the MEC will be known as duration of action. The corresponding time to Cmax is known as Tmax, that is the time to reach peak plasma concentration, and the entire area covered under this bell-shaped curve is known as area under the curve. These are the all important pharmacokinetic and pharmacodynamic parameters which are obtained after the oral administration of drug. But which are the pharmacokinetic and which are the pharmacodynamic parameters? So let's understand the difference between pharmacokinetics and pharmacodynamics. As we have seen, pharmacokinetics is what the body does to the drug. That means the absorption, distribution, metabolism and excretion of drug after it has been taken in the body. On the contrary, pharmacodynamics is what the drug does to the body. That means the effect of drug on the body. So you can say that the parameters which are obtained from the plasma level curve can be divided into two types. First, pharmacokinetic parameters, which include Cmax, Tmax and area under the curve. Cmax is the important parameter which depends upon three different factors. First one is the administered dose, second is the rate of absorption, and the third is rate of elimination. If you increase the administered dose, then the value of Cmax obtained will be higher, even though the Tmax will remain same. Tmax is the time corresponding to peak plasma concentration, and it is an important parameter that determines the rate of absorption of drug in the body. Tmax is an important parameter in the acute conditions like pain, where the onset time is an important parameter determining the pharmacological response in the body. Third one, area under the curve. It represents the total area under the curve. That means the total systemic absorption of drug in the body. So it is the most important parameter that helps to determine bioavailability of drug from the dosage form. If you are measuring peak plasma concentration in microgram per ml, time in hours, then AUC will be measured in microgram per ml into hour. On the other hand, the effect of drug on the body will be shown by these pharmacodynamic parameters, that is MEC, MSC, onset of action, onset time, duration of action, intensity of action, therapeutic range, that is the difference between MEC and MSC, and therapeutic index, which is the ratio of maximum safe concentration to minimum effective concentration. Now, what do you understand by the rate constant and order of reaction? The velocity or the speed with which a reaction occurs is known as the rate of reaction. The manner in which the concentration of drug or reactant influences the rate of reaction or process is called the order of reaction. So if you have a chemical reaction in which drug A is converting to drug B, then the rate of forward reaction will be explained as minus dC upon dt, where C represents the concentration of drug A. The negative sign indicates that the concentration of drug A decreases with time, and on the other hand, the concentration of drug B will increase. So the generalized equation to determine the rate of reaction will be minus dC upon dt is equal to K C raised to small n, where capital K is the rate constant of the reaction and small n is the order of reaction. So normally we observe two different types of reactions after the drug is absorbed in the body. The first one is the zero order reaction and the second one is the first order reaction. Zero order process can be defined as the one where the rate is independent of the concentration of drug. That means it is a constant rate that will not increase even on increasing the concentration of reactants. If we consider n is equal to 0 in the general equation, then zero order reaction equation becomes minus dC upon dt is equal to K0, where K0 is the zero order rate constant. What is first order process? Now here the n will become equal to 1. That means the rate is directly proportional to the concentration of drug undergoing the reaction. That means if you increase the concentration, then the reaction rate will increase. Due to such proportionality between the rate of reaction and concentration of drug, first order process is known to follow linear kinetics, and the equation for first order reaction is minus dC upon dt is equal to capital K into capital C, where K is the first order rate constant. So now basically you are asked what is the comparison between zero and first order kinetics. So if we compare all the different aspects, then the first one, graphical representation. Based on graphs, how can you differentiate between zero and first order kinetics? So here you can see that if you plot a normal Cartesian plot of plasma concentration versus time for zero order kinetics, then you get a straight line due to the constant rate of reaction. But if you plot a Cartesian plot of plasma concentration versus time for first order kinetics, then you will get a curvilinear graph like this, where there is decline in the concentration with time. So here you can see both first order and zero order Cartesian plot on the same graph, and the difference is obvious. Now the same parameters, if you plot on a semi-logarithmic graph, then that means if you plot the graph of log C versus time, then you will get a straight line in case of first order reaction, whereas in case of zero order reaction you get ever increasing concentrated gradient bulging curve like this. So based on the graphical representation, you can determine whether any unknown reaction is following zero order kinetics or it is following first order kinetics. Apart from graphical representation, the other differences which are observed between zero and first order kinetics are, first one, the reaction rate. As we have seen, the reaction rate for zero order kinetics is independent of the concentration term, Whereas in case of first order kinetics, the rate is directly proportional to the concentration of drug undergoing the reaction. The rate equation, if you integrate the equation between the two limits of concentration and time, the final equation that you get for zero order kinetics is C is equal to C0 minus K0 into T, where C0 is the initial concentration at time t, C is the final concentration at time t, and K0 is zero order rate constant. If you process for first order kinetics, then the final equation you get after integration is ln C is equal to ln C0 minus K1T, where K1 is the first order rate constant. If you convert this natural logarithmic equation into logarithmic scale, then you get the equation log C is equal to log C0 minus K1T upon 2.303. Next difference is observed in the half-life value. What is half-life? Half-life is the time period required for the initial concentration of drug to reduce to 1/2. That means the half-life is directly proportional to the initial concentration of drug. In case of zero order kinetics, whereas the half-life value is constant and it is independent of initial drug concentration in case of first order kinetics. Examples of zero order kinetics are metabolism, protein drug binding, enzyme or carrier mediated transport under saturated conditions, or controlled drug delivery through constant IV infusion, osmotic pumps or intramuscular implants. Most of the pharmacokinetic processes, namely absorption, distribution and elimination, follows first order kinetics. So I hope that you all are clear regarding the basics of pharmacokinetics, which will be helpful to you in further understanding the different pharmacokinetic models. Thank you for listening to this session, and do subscribe on our YouTube channel Pharma Ignite to get access to all the important lectures on pharmacy.